Hello and welcome to our live telephone town hall meeting. Thanks so much for joining us for this live teletown hall with 20th Congressional District of California. We're dialing out right now to tens of thousands of your neighbors, and we'll be starting with this live forum in just a moment. Thanks to those of you who dialed in early on our inbound participant line. We appreciate you being on time for this live teletown hall. We're going to provide accurate and up-to-date information on COVID-19, the coronavirus, tonight. And we have Congressman Panetta here along with a panel of public health experts that he's assembled to provide information and help answer questions tonight. So we're going to start with some updates from that panel of public health speakers. And as you're listening, be thinking about questions you'd like to ask live in our forum. We will have a Q&A session after we get updates from all of our public health experts. So we will also get some updates from the Congressman. And while you're listening, think about questions you want to ask, and then as soon as you have a question you want to submit for Q&A, please press 0 on your phone to submit that question to an operator. You'll give that question to your operator, and then you'll have the opportunity to ask your question live in the forum. But if you're not comfortable going live, that's fine. You should still press 0, still submit your questions to our operators, and then let them know if you want me to read your question instead of bringing you live, whatever's more comfortable for you. Either way, press 0 at any time to submit a question for the operator, to the operator, and let them know if you want me to read it or not. Again, this is a live teletown hall, and welcome to it. We're on the line with your Congressman, Jimmy Panetta, and we're dialing out to tens of thousands of your neighbors in the 20th Congressional District of California. We're going to be getting started any second here, so stay tuned. Once again, if you'd like to submit questions for the Q&A portion of our teletown hall tonight, you can press 0 at any time. And if you'd like to get updates from Congressman Panetta via email, just press 7 on your phone to speak to an operator and give them your email address for updates. Again, you can press 7 now to get email updates from Congressman Panetta's office moving forward. We'll make sure we keep you updated digitally in the future. So again, that's 0 to submit a question. Again, we're going to start off with some updates and some important information from Congressman Panetta and an assembled panel of public health experts. And then we'll go right to your questions, so 0 for questions, and 7 if you'd like to get email updates from Congressman Panetta. Again, 7, and we'll keep you updated as we move through this situation. So thanks again, everybody who's joined us. I'll turn it over now to your Congressman, Jimmy Panetta. Go ahead, please.
Ian, thank you very much. I appreciate this opportunity to continue to speak to people about these very distressing times and what we're going through and what we're continuing to do in order to address it. So let me thank you, Ian. Let me thank my experts that are on the phone line tonight. I truly appreciate that. And obviously, let me thank the people who have taken the time out of their evenings to call in, to get informed, to ask questions, and to make statements that can truly, I hope, benefit all of us in dealing with this, what I have termed and what I agree is an absolutely bruising pandemic. I'm sorry if I feel a little rushed. I just came back from the Monterey County Food Bank over in Salinas, where I greeted and thanked and showed my appreciation, keeping proper social distancing, of course, to the National Guard's men and women that are there at the Monterey County Food Bank. I'm actually turning around and watching, I'll give a plug out to KSPW, watching the news, and they're actually showing it on TV right now. And I was able to basically talk to these local men and women who have actually stepped up and stepped forward and are helping out with the food distribution that is so necessary at this time. And I also want to give a shout out and a much appreciation to the governor for heeding our call. I wrote a letter to him asking for the National Guardsmen and women to come in and to help out with that food distribution. So it's good to see efforts actually coming to fruition based on certain efforts that I made as a member and also what the governor's doing and with the National Guard. So thank you to all of them. Let me just give you some numbers right now that I saw when I got home just a few minutes ago on TV and on the internet, and when I just turned around and watched on the local news. 65,000, that's how many cases across our country. 921 deaths across our country. 60 cases here in the Congressional District 20, 3 deaths in Congressional District 20. In California, 2,500, 35 cases, 53 deaths. This is, as I said last week, and as I'll say it again, this is still going to get worse before it gets better. And I believe that these are just premonitions of the pain that we are going to feel, obviously physically, health-wise, but also economically. What I've read in regards to the economy we're putting ourselves in what I've read is a medically induced coma, unfortunately. But that is what we have to do in order to flatten the coronavirus curve and so that we do not overwhelm our medical health system, as we unfortunately are seeing in other parts of the country, New York as an example. We are seeing unemployment claims absolutely skyrocketing. In fact, one of the states, I think it was Ohio, which is a major state, their website for unemployment insurance crashed this week because there are so many claims. What they're saying is it's going to be the worst unemployment rate in history when these numbers come out. It could be as bad as 12.8%. Just to give you an idea, excuse me as I hang up on this person, just to give you an idea, that it was 3.5% in February. Now, what are we doing in Washington, D.C., which we can talk about to address this issue? Obviously, last week I talked about the first two bills that we passed that dealt with the emergency. And like I said, the strategy that I see in being employed is locally executed, state mandated, federally funded. And we have been working hard to continue to fund that. We did it in the first two bills, and now we are doing it with the bill that we are working on it right now. We have yet to see the text, although we are in negotiations about certain aspects of what the bill should contain. Yes, it should contain, and it will contain, a bailout for small businesses up to $350 billion with a B for those businesses, things having no fees on loans up to $10 million, and repayment based on how many employees you keep, such aspects as that. Yes, bailouts for large industries as well, those who employ hundreds, thousands of people. However, there will be certain guardrails on those bailouts, including an inspector general, a new inspector general, including an accountability committee to watch those bailouts, to watch those industries and how they use that amount of money, and making sure that it's not necessarily top down, but employee up, making sure our employees are taken care of. We're going to expand the unemployment insurance benefits. Close to, right now, the average is $385 per week one can obtain. We're going to try to increase that to $600 per week. This is one of the negotiations that we are pushing for. Who can it go to? Independent contractors, going to include them. People who work in the gig economy. Those who are laid off but not fired. They can then maybe receive money subsequently. And then we're also going to try to extend the length from 26 weeks to 39 weeks. And then, of course, you've heard about the cash distributions. It's going to be $250 billion worth. Each family in America will receive that. You're going to get, right now, the numbers that we're looking at are $1,200 per adult, $500 per child. Now, there are certain limits as to whether or not you pay that back, whether or not your income is, as an individual, $75,000, or as a couple, $150,000. Look, I believe this type of stimulus package, which will be the largest stimulus package in our nation's history, is something that's necessary. With 12 states making non-essential businesses close, 17 states ordering people to stay home. Yes, you can telecommute for the white-collar jobs, but the people that are going to get hit most, especially those here on the Central Coast, are those who work for and with the restaurants, the hotels, the retail industries. Now, yes, I'd love to see business open up by Easter. All of us would. But I know better, and I think we need to listen to scientists in making that decision. And I hope that those who make those decisions are actually listening to those around them that are actually using science upon which to make such decisions that could actually hurt us if we do it too soon. In the meantime, I continue to believe that once we continue to come together, as difficult as that is with this type of pandemic that's actually asking us to stay at home, to stay separate, I do believe that it is our nature to come together. An example of coming together is what I saw at the Monterey County Food Bank, what I saw at the Santa Cruz County Food Bank, with National Guardsmen and women who are from here, who grew up here, who are actually then stepping up and serving here. It's what I heard about before I got on this phone call, where I got a text from a local supervisor basically saying that the Salinas Valley Memorial Hospital has actually donated medical supplies to me Memorial Hospital, a rural hospital down in the southern part of Monterey County. It's that type of teamwork that I think we have to continue to show at all levels. And I promise you that is the type of teamwork I will continue to demonstrate at the national level. As bipartisan of an effort this is going to be, I know that many of you understand that that is how I try to do things. But I also try to be realistic when it comes to the facts and making sure that we talk about the facts. And as offensive as the facts may be, the fact is that sometimes they're the truth, and you may not like it, but the fact is that this is going to be difficult going forward. And I can tell you that going forward, we need to continue to listen to those who know it best. It's an honor for me to introduce to you our experts at this time who I feel know it best, who are on the phone line. And I will start off and introduce them, but I'll also ask them to give a few moments of an update as to what is going on at the local level. These are men and women who are on the front lines, who are dealing with the healthcare crisis that we are working with and trying to remedy as best as we can. So the first person I want to thank for being on is Dr. Martha Blum. Dr. Blum is the medical director of infection prevention at the Community Hospital of Monterey Peninsula. She joined the group back in 2014. She's board certified in infectious disease and internal medicine. And Dr. Blum, it's an honor to have you aboard, and please say hello to everybody. Thank you.
Oh, thank you very much, Congressman Panetta, for the invitation to participate this evening. I really appreciate it. It is my pleasure to share with everyone all that we're doing at Montage Health to best prepare for coronavirus here on the Monterey Peninsula. So at Community Hospital, we began our preparations and response back in January. And so although our initial preparations focused primarily on our emergency department in the hospital, we very quickly extended our preparations more broadly. And since that time, we've been giving guidance to our local clinics, to our outpatient service areas, to local urgent care offices, as well as other community medical practices to give them best advice for how to prepare and respond as well. So we have been testing people for coronavirus since late January, and beginning the 6th of March, we've been very grateful to have local testing capability at our own Monterey County Health Department Public Health Lab. And beginning on the 11th of March, simultaneously with Natividad Medical Center and Salinas Valley Memorial Hospital, we opened our emergency department respiratory illness triage area. And that has allowed us to safely evaluate people who have symptoms that may be due to coronavirus infection. I think that's a great example of what you just talked about, that the whole community working together. Further, since the governor put in his shelter-in-place order on the 16th, asking vulnerable people to stay at home, subsequent to that, we had our first Monterey County resident test positive for coronavirus on the 17th, and our local health officer, Dr. Ed Moreno, who's also on this call, I'll let him say more about it, he followed up the governor's order with a stay-at-home order for Monterey County residents on the 18th. So since that time, we've been identifying increasing numbers of cases, both travel-related and community-acquired here in the county. However, we're not seeing large numbers of severely ill COVID-19 cases. The vast majority of people so far are with mild disease, with people being able to care for themselves at home and not requiring services within the hospitals. There's a large team of people at Community Hospital, and indeed a coordinated group throughout the county involving all 4 hospitals, including the Memorial as well. And we've been working together to make the best use of all of our resources and capabilities to care for all Monterey County residents. So we've been working together to manage our testing capabilities, our supplies of personal protective equipment, or PPE, which I'm sure now everyone knows what PPE is. We've been managing our hospital capacity, and this includes preparing for possible surges of large numbers of moderately to severely ill people with COVID-19. So we've also been working tirelessly to protect all of our healthcare workers. We want to make sure that they have access to all of the necessary PPE so that they can be properly geared up when they're evaluating or treating people with coronavirus. And we've been tirelessly educating everyone about the proper ways to use the protective equipment. I would like to point out that we're lucky that we are not the first area affected. We are very lucky that we were not caught unprepared, as unfortunately some other areas such as Seattle, Santa Clara County, and indeed now we're seeing New York City. So we're learning from the experiences of these other places where they weren't necessarily completely ready and prepared to deal with large influxes or surges of patients. So we are very lucky that we've been staying at home here in Monterey County more or less from the time that the first cases were diagnosed, and that'll have a huge benefit to us. So over the coming weeks, we should start to see the results of having everyone stay at home. And staying at home is one of the very best ways we can prevent coronavirus from spreading in our community. And I want to tell people that I have a husband and 2 school-aged kids at home, so I know that can be asking a lot to ask everyone to stay at home when they'd really rather be out playing and hanging out with friends. But I want to urge people that they need to practice social distancing. They need to stay at home when they're not required to go out for something essential like a doctor's visit or to get groceries or food. I remind everyone, keep your hands clean, avoid touching your face, and frequently disinfect surfaces in your home with disinfecting wipes. And finally, if you are ill and able to care for yourself in your home, please do so. So if you do this and tell your family, your friends, and your neighbors to do this as well, I think we'll all fare better for it. I look forward to hearing whatever questions I can help answer.
Outstanding. Thank you, Dr. Blum. The next person I'd like to introduce is the person you mentioned, Dr. Blum, Dr. Edward Moreno. He is the Monterey County Health Officer and Director of Public Health, and he can obviously help us answer questions about shelter in place and our county's work to fight the coronavirus and keep all of us here in this community safe. Doctor, please take it away.
All right. Can you hear me okay?
I got you just fine. Go ahead.
Excellent. Thanks. Well, thank you for inviting me to your event, Congressman. So I'm Ed Moreno. I'm the Monterey County Health Officer, and my role is that state law requires each county to appoint one health officer with the responsibility to enforce state laws and local ordinances that protect public health. One of those important functions that I have responsibility for is to conduct surveillance for communicable diseases. Those are diseases that can be transmitted from one person to another in our county. And in addition, the state requires that when I as a health officer have knowledge of a threat or potential threat due to a communicable disease, I am required to take all measures necessary to protect public health. So with that, I'll give you an update on where we are with COVID-19. In our county, as of today, we have 24 cases that are confirmed, and we have 1 death, unfortunately. Of those cases, 9 were travel-related, 6 were person-to-person transmission, where we could figure out who exposed the case. We have 4 that are community transmitted, which means we couldn't, based on our investigation, we could not determine how the person acquired it, which is an indication that it is spreading within the community in Monterey County. And we still have 5 under investigation. With regards to testing, we've completed testing on approximately 360 people to date. Our laboratory has just increased the amount of tests number of people that can be tested, which is up to 80 patients per day. And as far as our containment efforts, I mentioned we are still doing containment strategies in addition to mitigation strategies. Containment strategies are those that try to identify people who are infectious and try to prevent them from exposing other or as many people as possible. So what we do in public health is we conduct contact investigations. When we're made aware of someone that has COVID-19, we interview that individual and determine when they were infectious and identify people and groups of people who were in close contact with the confirmed case. We then go on to isolate confirmed cases and monitor them by our health department staff. And we are using CDC guidance to determine when a confirmed case can be released from isolation and leave their home. As regards to quarantine efforts, we also contact people that we understand we're in contact with a person. We educate them on how to remain in quarantine and what to do if they develop symptoms. And we're currently monitoring over 350 contacts to confirmed cases in Monterey County. We are also working with our Office of Emergency Services within the Emergency Operations Center, and specifically in the care and shelter branch of the Emergency Operations Center. That branch and the dedicated people working there are looking for opportunities and strategies to isolate people who have COVID-19 and cannot isolate themselves in a home. So a couple examples would be homeless individuals, and if possible, people who live in congregate living situations, so we don't return them to congregate living facilities. And the goal there is to slow down the spread of virus among homeless populations and those people at risk. And as far as our mitigation efforts, I just want to point out that COVID-19 is not confined to one part of the county. I believe that all residents should assume that people in their neighborhoods are infected with COVID-19, regardless of how large or small their communities are. And I want to point out that I understand that young people are less likely to be reported as confirmed cases of COVID-19. However, studies show that young people can still transmit the virus, even if they don't experience any symptoms. So by staying home and not congregating with friends while they're out of school, our younger residents will be less likely to spread the virus to their parents and to their grandparents, who are more likely to be hospitalized and die from COVID-19. As mentioned earlier, I issued on March 17th a health officer order which requires people to stay at home. And considering the continued increase of cases in Monterey County, I've extended that indefinitely. Shortly following my order, the governor and the state health officer issued their orders. So basically, people in Monterey County need to stay at home. They can leave to provide and or receive essential services. And we are working with law enforcement. We're looking with county parks staff and working with our county environmental health inspectors to educate businesses and the public about social distancing and the importance of complying with the county health officer order. So with that, I'll turn it over. Thank you.
Great. Thank you, Doctor. I appreciate that. Next, I want to introduce to you the Monterey County Administrative Officer, Charles McKee. Charles is the CAO and the day-to-day manager of the county and definitely assists with the duties with our Board of Supervisors. So, Charles, thank you very much for being on the line.
Thank you, Congressman Panetta, for organizing this. It's obviously a needed service for our community to get the message out and get the questions answered that everybody has. So originally, the Congressman said he's going to have experts on the line. So the experts are the doctors and the health professionals, and I'm more of the coordinator-in-chief, trying to make sure that everything gets coordinated throughout the county that is needed to address this pandemic. The greatest thing here is that we have a wonderful community that's coming together and is by and far heeding the advice of the health experts to shelter in place and only go out for essential services. And only the essential businesses and operations are going forward at this time as far as we can tell. There are some folks out there that may have some confusion about what is an essential service or essential business. We have information about that up on our website, and you can go to co.monterey.us and find that information. As far as what is an essential service or business, there are a lot of businesses listed there. And so if you're going out in the community and you see a business open, you may wonder whether it's legitimate or not. You can check that list and see if that's appropriate. We want to thank all those businesses and essential workers who are out there. You know those healthcare workers and nurses and doctors and orderlies and janitors who are working in the hospitals, and they are definitely on the front lines, and we applaud them. But there are other workers out there that you may not be thinking of. Of course, you saw them at the grocery store and at maybe your Ace Hardware store, and we appreciate that. The agricultural workers in the fields, they are out there working, toiling to bring food into the community, to get them the food into the supermarkets so that we can have food to keep us going. And that is a service that is going for the whole country. And so it's great to have such a wonderful asset here in Monterey County. We want to applaud those agricultural workers and all the workers who are on the front lines. You have the first responders who are out there. You have some road crew people that are out there trying to keep our roads working. And those are all really important services that are happening, and we appreciate it. A few things that the Board of Supervisors has led on recently to try and help our community. One, as you heard Congressman Panetta talking about the food bank. Yesterday, the Board of Supervisors approved $250,000 to go to the food bank to buy immediate supplies because they were running low, and we have our food bank is serving far more than they normally do because obviously there are a lot of people who are losing their jobs at this point, and some of the schools aren't being able to feed students that they normally feed. So we appreciate the board stepping up and providing that money to the food bank. They also approved an ordinance yesterday to have a moratorium on evictions, both residential and business. And that doesn't mean that you're not obligated to pay your rent. Everybody is still obligated to pay their rent. But if they are impacted by COVID-19 and have shortages of funds because of that, an eviction will be suspended at this point. No eviction should be going forward, and appreciate the board stepping up on that. The Department of Social Services and the Health Department are also working hard to address the homeless population issues surrounding COVID-19. As you might suspect, if COVID-19 hits the homeless population, that would be very serious and very difficult to address. We are pushing out washing stations and toilets into those communities so that they have the hygiene necessary to help stem COVID-19 and stem the spread of that disease if it should hit that community. And in addition, the healthcare workers are going out trying to make sure that anyone in that community who is exhibiting symptoms is being seen and checked out and screened. If we get to a situation where COVID-19 is found within the homeless population in Monterey County, we want to make sure that we have the resources standing up quickly to address that. We are securing hotel rooms, motel rooms to house if necessary at that point. We are securing large locations where if we need to have homeless housed, both on the peninsula and in the Salinas Valley. At this point, we are securing those locations to try to stand them up quickly to address the homeless population and COVID-19. I appreciate all the work that the Department of Social Services is doing in that regard. In addition, you might think that the county is shut down and we're not providing the regular services through social services, but we are. And I appreciate everybody who's doing that. The food stamp programs, SNAP and all those programs are still happening. Adult protective services, child protective services, those are all going forward because they are really important at this time because we here in Monterey County are very blessed by a lot of things, but there are also people who are less fortunate, and the Department of Social Services and the Health Department reach out and help those folks. And in this time of need, those services are really important. And then finally, I'd like to say that very soon we're going to hopefully get into the economic recovery part of this after we can stop the spread of this disease and have success. And, I don't think that's right around the corner, but it's pretty close in the future. And we are working on looking at some of the economic recovery tools that we would have here that we would build on from what Congressman Panetta is doing in Congress with that big stimulus package. So with that, I just want everybody to know that we are coordinating with all the hospitals, we are coordinating all our services, and we are here to work for the community of Monterey County.
Outstanding. Thank you, Charles. Again, the County Administrative Officer of Monterey County. Thank you very much. Next, Dr. John Walther, the Medical Director for the Emergency Department affiliated with the Watsonville Community Hospital. Dr. Walther, thank you for being a part of this.
Thank you, Congressman Panetta. I feel honored to be here among such distinguished colleagues from our neighboring county. We in Santa Cruz County, Watsonville Hospital, where I am the medical director of the emergency department, Dominican Hospital, the county health officer for Santa Cruz County, we're all doing similar networking on an emergency basis, similar to what our distinguished colleagues in Monterey County are doing. I'd like to get a little bit more visceral in discussing this. I've just finished 4 day shifts in my emergency department. We are also, like my colleagues in Monterey County at Salinas Valley, Natividad, and Community Hospital, are customizing our emergency department to be able to triage people to see the people that obviously don't have a lot of findings for COVID-19, to triage them, screen them, and get them home in an appropriate manner and keep them out of the main building. But I want to backtrack because we had the first patient in Santa Cruz County who died. This patient came through our emergency department, was recognized as probably having COVID-19, had a lot of risk factors, was very ill, and we kind of, we admitted him to our intensive care unit. We knew he would end up on a ventilator, and we knew that, almost like a terminal cancer patient, that his prognosis was terrible. I've been doing emergency medicine for, 30 plus years, almost 40. And emergency physicians, we see sick people all the time. We take care of a multitude of things. We're good at what we do at triaging and diagnosing and intervening in really sick people. This is the first time in my career that I'm dealing with, all of us are dealing with a new disease that we're learning about. We're constantly learning about this. We're learning new things almost daily about this virus, and we're appropriately trying to plan for a possible surge of patients. People need to understand that this is really serious and it's unprecedented. Congressman Panetta has described, what the effects on society are in terms of economics, in terms of, society shutting down. But I want to impress upon the listeners that this is something that not only affects the economy in a way that hasn't happened before, but will affect families, will affect, people. We have a large population that we serve in the south part of Santa Cruz County that are living in close quarters. They're living with multi-generations of family, grandparents, who, a lot of whom have chronic diseases that would make them more susceptible to having serious morbidity and mortality to this virus. So, I am so grateful to the people I get to work with. People are really stepping up to the plate, not just in the emergency department, but all through the hospital, all through my colleagues in the Santa Cruz County Health Department and at Dominican Hospital. And it's important that we all work together, but the public really has to understand that this sheltering is really not only to protect them, but to protect their families, and also to protect the people on the front lines, like these wonderful people that I get to work with every day. We need to stay healthy. We need, adequate supplies. We need PPE that Dr. Blum mentioned. We're going to need ventilators. We're going to need hospital capacity. There are some models that predict perhaps as close to 2 weeks from now, we will be seeing possibly 100 to 200 patients a day between Dominican and Watsonville that need hospitalization. They estimate that 20 of those, we have about 20% capacity for seeing that many people. So this is a big deal. And, fortunately, as was mentioned before, there's kind of a calm before the storm going on now. We don't really know what's going to happen. We know what's happening in other areas for varying reasons, but it's a big deal. And, fortunately, we have really smart people that are networking along with us. We're having conferences. We're having task force meetings every day, sometimes twice a day. So my message is stay home, come to the hospital, call your doctor if you feel like you're sick. If you feel like you're really ill or short of breath, you can call your doctor, and if they suggest you come to the emergency department, we're happy to see you.
Thank you, Doctor.
So
I appreciate that. Thank you very much, Doctor. I appreciate that. And obviously, thank you for all of your service literally on the front lines of this, to you and Dr. Moreno and Dr. Blum. Thank you very much for what you guys are doing for the healthcare system and for dealing with this pandemic. So thank you very much. Last guest, and he'll keep it brief. I know he will. It's going to be Corey Williams of the United States Small Business Administration. Corey, thanks for joining me once again in the second telephone town hall in as many weeks. So just give a brief introduction if you could, Corey.
Thank you again, Congressman Panetta, for allowing me to be on the teletown hall again. A couple of new updates and since the last week when we had the teletown hall is that now all of our loans are going to actually have a 30-year amortization period. So for any of our small businesses that have maybe even the unsecured amounts to be able to amortize their loan potentially over a 30-year period, let's say a $25,000 loan, we're looking at a repayment of per month of only less than $100, about $92 approximately per month. In addition, Congressman, we also have a 1-year deferment. Last week it was a 5-month deferment, but we now have a 1-year deferment on all of our loans. And again, it's all fixed rate, 3.75% for businesses, 2.75% for our nonprofits. So the main thing, Congressman Panetta, we just encourage all small businesses to continue to apply, all nonprofits to continue to apply. And, we want to stand by as a federal agency behind all of our small business, small agriculture co-ops, and do everything we can to keep these businesses sustained during this pandemic.
Great. Thank you very much, Corey. And thanks to all of my guests and all of the experts, the true experts who are on the front line dealing with this. So thanks to all of you for being a part of it. Let's get to questions. Once again, please press 0 for questions and 7 to leave your email for any further updates from me. I would appreciate that. So, Ian, please take it away.
Sure thing. Thank you, Congressman. And 0 for questions, 7 to give email updates. And we're going to get our first question up from Barbara, who preferred not to go live, so I'll go ahead and read her question. She wants to know, do you know if heat kills the virus, for instance, in hot water, dryer, and sun? Congressman?
Well, I'll go ahead. I'm going to punt that to either Dr. Bloom, Dr. Moreno, or Dr. Walter, if any of you could see. I know the answer is hard to come up with yet, at least from what I've been reading, but let us know if there's anything different on that.
Well,
Sorry, it's Dr. Blum. I'll weigh in on that one. Coronavirus is subject to what we call low-level disinfection, which means your basic Lysol wipes, Clorox wipes, any kind of cleaner that you use will kill this virus. UV light, as in from sunlight, can also kill it. But again, most people's homes have UV coating on the windows, so I wouldn't count on just the sunlight killing it. And same thing with heat. Again, everybody's best bet is to use soap and water, wash your hands for 20 seconds, use alcohol-based hand rub, or use the common household cleaning wipes to wipe down all hard surfaces in your home.
And did another doctor wanted to weigh in on that?
Yeah, this is Dr. Moreno. If the person is asking because they don't have the running out of hand sanitizer or cleaning, I think that acknowledges that's an issue right now. And so people are thinking, what else can they do to protect themselves from COVID-19 that might be on commonly touched surfaces? I think that what's really important is the most important thing is to try to distance yourself from people who are sick and washing your hands frequently for at least 20 seconds with soap and water.
Thank you, Dr.
Great answers.
Okay, great. Thank you, Dr. Walter. All right, thanks to all three of you. Go ahead, Ian, please, go ahead. Next question.
Sure thing. Great question, Barbara. Thank you. Next one's coming from Diane. She's live from Carmel. Go ahead, Diane.
Hello. I would like to know, is there anything in that bill that seems to be stalled at the moment to address senior citizens, those of us 65 and older who are your constituents? Congressman Panetta, we vote for you. Is there anything in there for us?
Yeah, thank you. I appreciate the question. And I got to say, there's not a title that says for seniors. But if you look at the other titles and what they do for seniors, then the answer is yes, and I'll explain that. So first of all U.S. residents with the adjusted gross income of up to $75,000, like I mentioned earlier, who are not a dependent of another taxpayer and have a work-eligible Social Security number are eligible for the full $1,200 disbursement, as I talked to earlier, and that can be $2,400 if you're married. In addition, they're eligible for $500 per child, as I said earlier. Now, when it comes to supplemental nutrition assistance program, there's $15.8 billion with a B to ensure that all Americans, including seniors and children, receive the necessary food as appropriate. It also then waives the nutrition requirements for the Older Americans Act meals program during the public health emergency related to COVID-19, so that seniors can get meals in case certain food options are just not there for them. The bill then also waives the required minimum distributions from retirement accounts for 2020. What that means is retirees will no longer be forced to take distributions from their IRAs and 401ks, and that's important because stocks are down, as we're seeing, and the funds are obviously hurting. The Senate bill, which is in play right now, and like I said, we just got the text right before this phone call, and we're literally going through it right now. The Senate bill also waives the 10% early withdrawal penalty for distributions up to $100,000 for qualified retirement accounts. And then when it comes to housing for the elderly, there's $50 million, funds that will maintain housing stability and services for low-income seniors. So, but once again, there's not a title for seniors, but if you delve into each of the titles, dealing with food stamps, dealing with the waivers, dealing with the Older Americans Act, and you will see that it definitely takes seniors into account who need it quite a bit, especially in this pandemic that unfortunately has targeted senior citizens. Ian, please, next question.
Absolutely. Thank you, Congressman. Our next one's going to come from Laura, and she also preferred that I read it. She's in Santa Cruz, and she says, I've been sick for over a week. I'd really like to be tested as I have an underlying immune system issue. What can people like me do to start getting tested? That's from Laura in Santa Cruz.
And I'm going to punt that to any of the doctors, or if Charles wants to take it as well. It's up to you guys.
I'll be happy to take it from an emergency room standpoint. I'm assuming you have a primary care physician. What we're recommending patients who want to be tested and who aren't sick, to contact their primary care doctor, their primary care clinic, and discuss it with them. I think that makes common sense. Right now, unfortunately, there are a relative shortage of testing, at least in Santa Cruz County. We're not at the point where we can test everybody. That would be nice, but it hasn't happened. It may happen relatively soon, but as of today, we are unable to test everybody, even if they want to be tested. So my advice would be to contact your primary care doctor. If you don't have one, or if you're new to the area, call us in the emergency room. We give advice, And if there's any question that you're ill, we would be happy to see you.
Anybody else in regards to that testing aspect of it?
Yeah, Congressman, this is Charles McKee. What I would also say, I think that's great advice, and the primary care physician is the first line, and they know the criteria to ask. But if you don't have a primary care physician, or if you're having trouble getting through to them, there are many insurance carriers are providing telemedicine opportunities and online opportunities to get that same kind of advice about testing and screening, and even some other healthcare issues. And I don't know if Medicare does the same thing, but I know many of the insurance companies are doing that.
Great. Thank you, Charles. I appreciate that. And I know that in one of the two bills, we definitely made sure one of the lines in that bill was that eventually, I'm being that there will be free testing for everybody and that they will be covered. It's just making sure that those resources get down to the local level. And unfortunately, there is a lag time, but I can tell you we covered it in one of the two bills. Next question, Ian, please.
Yeah, thank you, Congressman. And also, I think some of the hospitals are also providing some phone and online screening. I think CHOMP and SVMH might be doing that already.
Yeah, Montage Health has free e-visits for people who want to get information that think that they may be infected with coronavirus. So that's on the chomp.org or montagehealth.org. You can get links to free e-visits.
And Ian, let me use my prerogative of hosting this town hall. Dr. Bloom, quickly go through some of the criteria that you're looking for in order to give someone a test if they show up at the hospital and say, I want a test. What are you looking for?
Great. So, well, first of all, I want to just reiterate what everyone else has said, which is if you're feeling ill but you can care for yourself at home, we would recommend that you don't leave your home but instead reach out by telephone or one of these e-visits to get the recommendations that you'd need for caring for yourself at home. Now, if somebody is more acutely ill, moderately to severely ill, and comes up to the emergency department, we do have a set of questions that we use to guide whether or not testing would be appropriate. So first of all, are the symptoms consistent with coronavirus infection, meaning do they have fever, cough, and shortness of breath? And then beyond that, we look to see, are they moderately to severely ill requiring hospitalization? And if that is true, then yes, we test all those people who are ill enough to need to be in the hospital. Now, aside from that, we also look for people who would be at risk for developing severe illness. So those would be people with chronic medical conditions like diabetes, chronic heart disease, lung disease, kidney disease, or people who are immunosuppressed because of cancer chemotherapy or other immunosuppressive treatments because of, say, an autoimmune disease, for example. So those people we would also prioritize for testing. And then finally, as has been alluded to, we're very concerned about detecting whether or not the virus is circulating in congregate living situations, so people who live in group homes or skilled nursing facilities or who are homeless, or otherwise at high risk for transmitting the virus within their population. So this would also include healthcare workers or first responders. So, in those instances, we take that into account when we evaluate who would be tested. But we are not testing anyone who is completely asymptomatic. Right now, there's no evidence to say what the value of testing an asymptomatic person, especially if it's negative, if that would give reassurances or not. So for the time being, we're really focusing on trying to detect the virus in these special populations and in the more moderately to severely ill people.
Thank you, Doctor. I appreciate that. Ian, next question, please.
Sure thing. Quick reminder, last call to press 7 to give us your email address and get email updates from Congressman Panetta. Again, press 7 right now if you'd like to get email updates. Jeanette and Marina, you're live.
Yes. My question is about any extensions or relief for property taxes or mortgage payments.
Yeah, thank you very much. I appreciate that. I will attempt to answer that in regards to what we're learning about the bill that's coming up and that we're continuing to work with. Look, while property taxes are not a federal jurisdiction, we're working to help homeowners. The Senate bill that's out there right now, it halts foreclosures on all federally backed mortgage loans backed by the Fannie Mae and Freddie Mac, and that are also insured by HUD, the VA, or the USDA, are directly made by the USDA for a 60-day period beginning on March 18th of 2020. The bill also provides up to 90 days of forbearance for multifamily borrowers with a federally backed multifamily mortgage loan who have experienced a financial hardship. For 120 days, landlords are also prohibited from evicting from properties which are backed by HUD, Fannie Mae, Freddie Mac, the Rural Housing Voucher Program, or the Violence Against Women Act of 1994. I think, as you can tell, based on what I just read to you, I admit I just read that to you based on we're getting this bill, it does make strong investments in the affordable housing programs and homelessness programs as well. And Charles, I'd go ahead once again. Why don't you repeat what the Monterey County Board of Supervisors did and what other county supervisors are doing as well when it comes to rent?
Yeah, so on rent, the Board of Supervisors modeled after what the state is doing, adopted an ordinance that put a moratorium on evictions for both residential and businesses at this time for your inability to pay due to COVID-19. The duty to pay isn't relieved, but eventually you may have to pay it back or should have to pay it. But at this point, there's a moratorium to give you some relief. As far as the property taxes go, the problem for California tax collectors is that they don't have the authority to delay that, and the Board of Supervisors doesn't have the power to delay that locally. And the decision is actually something that has to be done at the state level to delay property tax payments.
Great, thank you very much. And let me just also follow up on something I just kind of found here in my research in regard to the testing. We spent on the first two bills. We're going to spend $950 million, of which $475 million must be allocated within 30 days. 30 days. So there's that timeline that I didn't have earlier, and I apologize for that. $475 million must be allocated within 30 days to support states, locals, and to help conduct public health activities such as surveillance of the coronavirus, lab testing, and to detect positive cases, just to let you know. Ian, next question, please.
Absolutely. Let's get our next one up from Julie. Hey, Julie, can you tell us where in the district you're from, and go ahead with your question, please.
Yeah, I'm from your district, Congressman Panetta, and my question has to do with child care workers who are essential employees. However, they're not receiving any hazard pay. How can we make sure that we're compensating our child care workforce for their additional risks?
And look, I think independent contractors is something that we have definitely taken into account in this bill. As I mentioned, they are going to be covered for unemployment insurance going forward, because obviously we understand that those are the types of people who are going to be hit the most. And so those types of independent contractors, be it child care, be it senior care, be it health care, be it people who provide their own health care, people who are I read something today in regards to house care, house cleaners as well, and people are part of the gig economy. Those are all going to be covered by the unemployment insurance benefits that we're going to expand up to $600 per week. Let me repeat that, $600 per week, when the average now is $385 a week. We're going to expand not just the amount, but also the time in regards to weeks that one can obtain unemployment insurance, which they can extend, which is going to be extended from 26 weeks to 39 weeks. So it's quite a bit. It's a lot, but I can tell you, based on what I'm hearing, what we are seeing, and what we are feeling, especially here on the Central Coast, that amount, that amount of money is going to be needed. That $260 billion it is that we're going to provide in this next bill is going to be needed. So thank you for that question. Next question, please.
Sure thing. So this is one we're getting a lot from both this main English language broadcast and our Spanish simulcast. So I'll ask it on behalf of all the people who have submitted it. The question for you is, what are you doing to support our local food banks as they experience unprecedented levels of demand?
So look, if I may, and if anybody wants to pipe up on that one too, but I can tell you I just came from the food bank, as I mentioned in my opening statement. Last week I was in Santa Cruz County. Today, literally right before I got online for this call, this town hall, I was in Monterey County. I've been in contact with San Benito County. I've been in contact with Santa Clara County and the food banks up there. The first thing that we did in our conversations with them is realizing that, like I said, this is a pandemic that pushes people into their homes. It doesn't draw them out of their homes. And so that's going to hurt the food banks in regards to the people who are helping out at the food banks, but also the fact that it's going to hurt people who are not going to want to get in line at the food banks. So the first thing I did was send a letter and reach out to Governor Newsom and ask for the National Guard to be activated. Now, first they put on alert, but I can tell you today they're activated. They're in Santa Cruz. They're in Monterey County. We're continuing to work with San Benito. Oh, they're in Santa Clara County. We're continuing to work with the OEC in San Benito County to make sure that they take their proper steps to make that request, and hopefully the National Guard will be there to help that food distribution. On top of that, we've let people know that the food banks are in need, not necessarily of the food. And what I'm hearing is the food is there, but what they need, obviously, are resources. And so you're seeing a lot of people step up, donate, try to volunteer, just help out as best as they can from their couch at this point. But knowing that, literally seeing these National Guards, men and women who were from this area, they're packing bags, working together to make sure that that food not only gets packed up, but gets put out there to the families that need it the most. To me, that's what this community is about. And that's what all of us are about, is making sure that in times like this, we do come together, be it through service through our National Guard, but also service to the people that need it the most when it comes to getting the food from our food banks into the homes of those people who are the most vulnerable at this point. Next question, Ian, please.
Sure thing. We've got one coming here. This is from Susan. Susan, you're live. Go ahead.
Thank you very much. Thank you, Congressman Panetta. My husband and I are both independent contractors. He's a contractor and I'm a realtor. Our adjusted gross income was $134 last year. How does that apply to the coverage that you work so hard to provide?
And I'm sorry, is she still on the line?
Yes.
Yeah, she is.
Okay. And so you're talking about independent contractors that will be covered under, I would imagine, under the bill that we're soon to pass. Is that correct?
Yes.
Yeah, of course. Look, I think the Senate bill, as we're looking at it, it creates a pandemic unemployment assistance program to provide, I guess we call it payment to those not traditionally eligible for unemployment benefits. And we've talked about this on this call, self-employed, independent contractors, and those with limited work history, to be frank, and other people who have that type of work history. It provides, like I said, we're up to $600 per week payment to each recipient of unemployment insurance or the pandemic unemployment assistance for up to, like I said, they're expanding it to 4 months. The biggest thing here is that independent contractors, I can't stress this enough, from my last answer to my introduction, independent contractors, including gig economy workers, along with other self-employed individuals, those people are eligible for small business loans too in this bill that we're working on right now. On top of that, you're going to have, as an independent contractor, heck, as an American, you're going to be able to receive that $1,200 direct payment as well. So there's a number of steps in the bill that people, if you're an independent contractor, if you're not, can use going forward. So that's what we're working on right now. But thank you for that question and the clarification. Next question, Ian.
And actually, Congressman, we're about at the end of our hour. We've got plenty of time for you to make any closing comments or thoughts that you'd like to make before we get to the end, of course. But for anybody who didn't get a chance to submit an email to one of our operators, you can go to panetta.house.gov/contact/email. So again, that's panetta.house.gov/contact/email if you don't get a chance to go to your email address and get updates tonight. So you can go ahead and take us to the close, Congressman.
Ian, I'll make it quick because I know we're out of time, and I appreciate the opportunity to do this. First and foremost, thanks to all of our experts that are on the line, the doctors, Dr. Blum, Dr. Moreno, Dr. Walther, Charles McKee, and, of course, Corey Williams, who didn't get a chance to talk. I know that's okay with you, Corey, but let me tell you, a lot of people are going to be relying on the Small Business Administration. They have been. They will continue to do that. Know that my office is there. My office is open. My office is answering phones. My office is there to assist you in dealing with this pandemic, in dealing with the federal bureaucracy, in dealing with ways to obtain some of these resources that we are working on in Washington, D.C. at this point. Please know that if you have an issue with the federal government, please be sure to call my office. Be sure to call my office in Santa Cruz, call my office in Salinas. Feel free to call my office in Washington, D.C. The Salinas office is 831-424-2229. The Santa Cruz office is 831-429-1976. The Washington, D.C. office is 202-225-2861. Please reach out. If for some reason we're on the phone, we don't answer, you call after business hours, please leave a message and know that you will get a response, especially if you're in need of a service helping you with the federal government. I cannot stress that during this time, our office is open, our office is available for you, and that we need to continue to thank those on the front lines. Know that Congress is making sure that those on the front lines continue to have the necessary PPE as discussed by Dr. Blum and the other doctors. We're continuing to fight for them to get that. They make sure they have the masks, make sure that the ventilators are there, make sure that our stockpile is increased. These are all part of this upcoming bill that we are working on right now. This is the fourth telephone town hall I've done in 2 weeks. I did two hosted by myself. I did two others with a couple of other congressional members just north of my district. And I look forward to continuing to have this type of outreach as best as we can. When we're told to stay in our house, know that we are there. Please reach out to us. We are trying to reach out to you so that you have the appropriate information going forward so that all of us can deal with this pandemic together, be it health-wise, be it economic-wise, be it financial-wise. Know that we are there for you. And as you heard from all of our experts, there are many, many, many people on the Central Coast that are continuing to step forward, not step down, but step forward into the face of this pandemic. And that's what it's going to take as we go forward and beat this thing, which we will, as long as we do it together. So let me thank you. Let me thank my local burrito place, which I get to enjoy my burrito now. We did takeout tonight, which I recommend everybody doing, and everybody enjoy the evening. And I look forward to talking to you soon enough. So thank you again, Ian. Thank you. Thanks to everybody.
Thank you.